Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Welcome to Arizona Barrio Stories, Latino USA TV. Welcome. Isn't this weather crazy? We thought it was 100 degrees yesterday and now we're in the 60s. We can't tell what the weather's going to be like, but one thing we can tell and one thing we know for a fact is David Para Luna with Arizona AARP, Arizona Hispanic Connection. He always has something good for us. And today, no doubt, he will bring us something really good. Welcome, David. I see you have long sleeves. Thank you for being here through the cold, through the hot, through the summer that we had. Welcome.
Thank you, Irma. My pleasure. Sure enough, it's getting colder in our state, so came prepared, not only physically but more mentally with my topics of today, which is Medicare. We know that towards the end of the year, we have open enrollment. And it's interesting that we have open enrollment pretty much for all insurance. You know, I just went through mine at work, and we know that the Medicare has open enrollment, and then the Affordable Care Act, the marketplace also is on open enrollment. So we're going to tackle Medicare and the marketplace, but we'll start with Medicare.
My mailbox is being flooded with different companies. I guess this is open enrollment, and so I'm being flooded with information.
Yeah.
So to get started today, let's go over who qualifies for Medicare.
Yeah. Medicare is for people 65 and over who have earned 40 credits through 10 years of employment, or the spouses of such person. Sometimes spouses didn't accrue the credits, but if their significant other does have the credits, then they qualify for Medicare. Also for people who are deemed disabled, they are declared disabled by the Social Security Administration, and they have been on SSDI, disability, for 2 years. This implies that they're younger than 65. So even younger than 65 can get Medicare if they meet that qualification that I just described. And then people with end-stage renal failure, they also can get Medicare pretty fast in those circumstances.
Is there only one type of Medicare? Are there different options?
You know, this is an excellent question, and we'll come back to the open enrollment dates, which are very important further down in the show. But, you know, I've always told people that Medicare there's a way to think of Medicare that makes it a little simpler. And it's to think of Medicare as 2 options, 3 parts. 2 options, 3 parts. So the 2 options are original Medicare or Medicare Advantage. So everyone on Medicare should know whether they're on original or Advantage. When I do presentations in the community, I always ask, are you in this or doing that? And the majority, they don't raise their hand. That means they're not clear. Well, everybody needs to be clear whether they are on original Medicare or Medicare Advantage. And let's know that I always say that they made a mistake by calling Advantage Part C, because it's really not a part of Medicare. Advantage is the whole thing. So if you go through, you get Medicare through original Medicare, you're going to get A, B, and D. A, hospitals, B, doctors, and D, prescription drugs. Right? If you get Advantage, you're going to get A, B, and D. So when you get Advantage, though they call it Part C, you really get A, B, and D. So both have the same parts, the same type of coverage. They just work a little different. So we need to keep in mind that there's 2 options, 3 parts.
Good to know. I mean, I can see how it could be a little bit confusing for some people.
Definitely.
So ask questions.
Right.
I see here we have a 7-point comparison. Talk to me about that. What does that mean?
Yeah. To give folks an idea about how original and Advantage work, Advantage has to provide exactly at least the same coverage that original. So they shouldn't be concerned whether something is going to be covered or not. They offer the same coverage, both parts. So let's be clear on that, right? However, they work differently. And I probably will not cover all 7 points, but I'll cover as time allows. Okay? So the first one is that original Medicare is fee for service. Advantage is managed care through an HMO or PPO. So basically, fee for service means if you don't go to the doctor, Medicare doesn't pay anything. But managed care means that regardless whether you go or not, Medicare gives the insurance company of the one you selected, it gives them a kind of a premium to take care of you. And that's over for Medicare.
They get their cut.
That's it. If whether you ever go to the doctor or not, it's managed care. So they're being paid a premium to the insurance company to take care of you.
Whether you go or not.
Whether you go or not. That's a big difference, right? Which really doesn't apply much to us, but it's still a difference. Number 2, in original Medicare, you can go to any state of the country to take care, to get care, as long as they take Medicare patients, right? Sometimes they don't, sometimes they do, but even though they do, at that point where you try to make an appointment, is that we're not taking new patients right now. It can happen. But the bottom line is that you have a nationwide network on original, and you have more of a county with Advantage. If that's important to you, then you have choices. And this particularly applies to people who have 2 homes, right? They have a home in New York, they have a home in California or what have you, and they're in 2 places, so they want original Medicare to have the flexibility of not dealing with networks. So that's another important difference. Another one is that original Medicare doesn't have out-of-pocket max. So you're going to pay whatever you have to pay. Whereas Advantage does have a cap. That means out of pocket, you're paying for care, and if you reach your cap, let's say it's for $6,000 in September, it's over. You don't pay anything for the remainder of the year because you have reached your cap, your limit. That is important because the number one reason why people go bankrupt in this country is medical bills. So that is extremely important to have an out-of-pocket max. Advantage does it, original does not have.
Seems like original is a little bit more flexible.
It is, but then when we come to the number 5 or 6, you'll see something not so positive about that, and we'll get to it. Original Medicare, you have to buy Part B. Advantage, it comes with it in most cases. So that's an additional cost if you opt for original Medicare. You're going to have to buy a Part D plan. A Part D. I thought I said B, but no, it's D. Let's go to numbers 5, 6, and 7, all right? The reason why I believe you can word it this way, original Medicare allows you to go nationwide, is because they're only going to pay for 80% of the bill. Or because they allowed you to go nationwide, they only pay 80% of the bill, medical bills. So you're responsible for the other 20.
Do you have to meet a deductible on that?
Yes. The original Medicare does have a deductible. Advantage does not have a deductible. But it's tricky. There's some things, when you come to the hospital and all that, so it's a little bit more complex than that, but we're trying to make it kind of simple in this few minutes. So again, Part B it's called coinsurance. So let's call it the 80-20 rule, right? The 80-20, Advantage does not have that. They still have co-pays, but not 80-20, not 20%. Let's go to number 6. So Part D is purchase on original. I may have spoken about the Part B, but on Part D is where you have to buy it under original, and on an Advantage, you do not buy Part D. B you still pay for it. You still pay for it in both options, okay? That's what comes out of your Social Security. And this one is going to be the last one, the last on the 7-point comparison. To pay for that 20%, remember the 80-20? People buy Medigap. Medigap is also known as supplemental insurance to pay for that 20%. And you cannot combine it, that Medigap, with Advantage. So that's in a nutshell that I also want to say, because we're running out of time, I want to say that there's something called Medicare Savings Programs. Medicare Savings Programs. For people with low incomes, dependent, there are 3 levels. I'm just going to leave it at that. They have names, but each level has an income threshold. So if the first one, you meet the first one, you get the first level. And that is the equivalent of having Medicare and Medicaid at the same time. Ooh. So they pay for pretty much everything, including your Part B premium. Okay? But they give you, just like having an Access program in Arizona, and whatever Medicare doesn't cover, Access will do that, right? And then the other 2 levels, it does the same thing, meaning it pays for your Part B premium only, the other 2 levels. The first level is the one that gives you the most. And again, it's all based on income. So you need to talk to somebody for that, right? And I'm going to go pretty quick. This time that we're in open enrollment is not your initial enrollment. Let's be clear. Initial enrollment, it happens when you turn 65. So unless it happens to be in the same time, you can enroll. But other than that, it's not for enrollment. It's mainly for those already on Medicare and they want to make changes. They need to evaluate their coverage and see if it makes sense to make changes. This open enrollment will go from October 15 to December 7. And again, this is for people who are already on Medicare. So again, be mindful that people need to review their coverage. People need to make changes. And I will include a resource information so that folks can reach out for help if they need to. In a nutshell, Irma, this is what we have for today.
David, thank you. I'm sure somebody out there maybe it's their birthday month and they're thinking about it. And I know we had talked previously that you got to really get your ducks in a row, I think 3 months prior to your birthday. So I'm hoping somebody might need to reach out to you. Maybe they have some questions.
Definitely.
And hopefully they'll contact you.
I hope they do. And we welcome those calls. It's a pleasure to help.
Thank you.
My pleasure.
Well, that could be you. Maybe you are in that boat. Maybe your birthday is coming up and you're going to be that nice magic age where Medicare is on your foresight. Contact David if you have questions. Take notes. Do your research. Find out if it's something that you need on the different options. Contact David. Thank you from Arizona Barrio Stories and Latino USA TV. Thank you for being a part of this platform. And as always, we will see you soon.